Hi guys, and welcome back. In today's video, we're going to be talking all about estrogen dominance and how it affects your gut. Strap in, this is a doozy, and it's probably going to be a multi-part series. Let's go. So first things first, before we actually get started, we need to cover what estrogen dominance is and what it isn't. So let's break that down really quick first, and for that I have drawn a beautiful seesaw, or teeter-totter, whatever you grew up calling it. But you can think of your sex hormones, particularly progesterone and estrogen, as being on this seesaw and being in balance. Now, this does not mean that you should have the same amount of progesterone and estrogen. You'll notice that the lab reference ranges for these two hormones are very different, but their activity should be about matched. When they get to your cells, your cell should be able to cope with both of those and not be overburdened or overwhelmed by one or the other. So in the case of estrogen dominance, all that really means is that your estrogenic activity exceeds your progesterone activity. And you can manifest that in a couple of different ways. So for example, you can have estrogen dominance, quote unquote, because your progesterone is low. That would make it appear that your estrogen is way more active or way more abundant, and you would have all the same symptoms, but because of a deficiency of progesterone. Similarly, you could have normal progesterone, but you could have elevated estrogen. You could have genuinely high levels on hormone testing or blood work, and that could be the culprit as opposed to progesterone itself. And of course, you always have permission to go above and beyond and have both, where you have too little progesterone and too much estrogen, and then it's the double whammy of super fun times. And oftentimes I do see this pairing in my patients when I do get to the point of doing hormone testing. However, as a side note, I don't find a reason to do hormone testing 99% of the time. I think that it's overutilized in my profession, to be quite honest. But when push comes to shove and I do get around to testing for it, I do find that there's some degree of this pairing. But most often the overrepresentation of estrogen is more common from what I have seen clinically. Now that we know what estrogen dominance is, now we can talk a little bit about what it does. And I think the best way to do that is to draw one of my famous ugly doodles for you. All right, so let's get into it. And we have three main components that I'm going to be talking about in this video. We've got your brain. Yes, that's a brain, not a cloud. We've got your brain or your nervous system more broadly, your gut itself, and I tried to draw a fallopian tube and ovary. Whatever. It is what it is. Dry erase markers, what can I do? So one of the things to remember, of course, is that we have a gut-brain axis that is pretty stinking important, and the vagus nerve comes out the bottom of the brain, out of the brainstem, and it goes and it innervates or interacts with and controls basically your entire gut. Everything from the back of your throat all the way down to the last part of your colon, just about, is controlled by the vagus nerve and that gut-brain connection. And ultimately, everything in your entire body is controlled by the nervous system. So it's worth mentioning first that in the female brain, we have a lot more need for estrogen and we have a lot more receptors and pathways that are stimulated by estrogen. So first things first, estrogen is very excitatory and very stimulatory to the brain. So I'll just do an up arrow for increased activity. This is particularly true of serotonin. Serotonin pathways and estrogen pathways are very much intermingled, as opposed to testosterone and dopamine. They're a little bit more connected and intertwined. But you get an uptick in serotonergic activity, not only in the brain and the central nervous system, but also in the gut. And this is one of the first things that comes up with estrogen dominance is a change in motility. Most often, but not always, this is going to be seen as more frequent or loose stools, aka diarrhea. So increased or sped up motility and increased frequency and looseness of bowel movements is probably because the estrogen and the overabundance of it is hyperstimulating your serotonergic pathways in the gut itself. And then also remember that stimulating your brain, stimulating your cortex, will ultimately fire into the vagus nerve and fire up the gut-brain axis. So it might be facilitating goofy pathways for the gut-brain axis. And I know a lot of you are thinking, hey, stimulating my vagus nerve, that sounds like a great thing. Maybe, but it could be inefficient if it's a chronic issue and it's tied with something that is ultimately dysfunctional. So don't get too excited. But ultimately, increased serotonergic activity, both in the brain, central nervous system and the gut can lead to some deleterious and squirrely effects, most notably an increased or sped up motility. The other thing that estrogen does locally is that it leads to visceral hypersensitivity, which does tie in with the neurological system to a degree. So remember, visceral hypersensitivity is very, very common in IBS. Actually, it's kind of the hallmark of IBS if we want to be truthful about it. But it is this idea that you are perceiving pain from a stimulus that should either be less painful than you're experiencing, or it should not be painful at all. So it's either that the pain receptors are appropriately getting stimulated, but then they're just really going bonkers, or you're totally misinterpreting a signal. So like, I had a patient once who had very bad pain prior to having a bowel movement, and we discussed it and we said, I think you're actually feeling the stool move through your colon, and that you shouldn't really perceive that very much. And if you do perceive it, it shouldn't be painful. So that was one of these situations where it was visceral hypersensitivity. And ultimately what we talk about there is that the nerves are hyper responsive and they're misinterpreting signals. Well, that is ultimately a consequence of things like inflammation or too much estrogen on the nervous system local in the gut. So these neurons that live locally in the gut that are perceiving gut movement and gut interactions for you, they're ultimately getting overstimulated and overexcited and giving you this perception of pain or discomfort or excessive perception of bloating. So increased visceral hypersensitivity is very much linked with estrogenic receptors and that kind of estrogen neurological feedback loop in the gut locally. And then of course, this could happen in the brain too. Your central perception of that pain or that discomfort could also be heightened by that same estrogenic load, because again, estrogen tends to be very stimulatory for the brain, and it could have different interactions on the different neurotransmitters and the different pathways. It's a little hard to parse out in such a short video. Continuing on though, a lot of folks down here will also recognize that we have a lot of mast cells and immune cells in the gut. Well, estrogen stimulates mast cells and encourages them to degranulate. And I know I've done a handful of videos, maybe 6 months or more ago, about mast cell activation and histamine responsiveness, histamine intolerance, and the low histamine diet. If you want more info on those, go check them out. They're a few months old, but they should be right in the YouTube list somewhere. But increasing mast cell degranulation and increasing their number or increasing their activity also has been very well documented in cases of IBS. That's where we start to get more food allergies and food sensitivities, more visceral hypersensitivity, and motility problems as a direct consequence of those mast cells. So mast cells and estrogen dominance are very, very intertwined. And a lot of the mast cell problems that we see might be partially due to hormonal disruption, in this case, estrogen. So we've got increased mast cell activity in the gut. We've got an increase in peristalsis and motility that's going to send the material in your digestive tract shooting through at lightning speed. And we also have that visceral hypersensitivity. Oh, VHS, it brings me back to my youth. We've got visceral hypersensitivity also as a direct consequence of excess estrogen. And as an added bonus, before we get too far away from the nervous system conversation, remember also that stress and the HPA axis, that's supposed to be your pituitary, the HPA axis directly inhibits the vagus nerve if it is overly excited in the sense of fight, flight, freeze, appease. If you're launching right into your sympathetic nervous system and in fight and flight mode all day, you're never going to get rest and digest vagal nerve tone. And importantly, one of the centers of your brain, the amygdala, the part of your brain that is really tied in with trauma and stress, with estrogen dominance, you get an increase in corticosteroid receptors in the amygdala. So what does that mean? It means that the part of your brain that controls things like trauma responses and PTSD and stress responses, that part of your brain has an increased sensitivity to stress hormones in an environment where there's excess estrogen. And then that means that you're going to have a really hard time getting into rest and digest, right? Like, this is huge. This is huge. So something that might stress you out 10% now stresses you out 80%. And it's like off the charts stress and dysfunction, in part because the estrogen is promoting those glucocorticoid receptors in the amygdala, which is kind of a big deal. Last couple, but not least by any stretch of the imagination, is that estrogen does seem to interact with the microbes in the gut and vagina for that matter, and elsewhere in the body. We don't know all of the interactions yet. I think we probably will learn more in the next 10, 20, 30 years. But one of the things that's been starting to be documented is that hormones can affect the expression of virulence factors in the microbiome. So virulence factors are the things that make the nasty bugs real nasty. So it means that they can attach more firmly, they can make more biofilms, they can hide out, they make toxins, they make little nasty pokey things that can pierce your cells. You don't want virulence factors. Just, I'm going to throw that out there as a general blanket statement. Well, hormones do seem to affect how many of these virulence factors are expressed in our microbiome, and it makes you wonder what they're sensing and why it is that the bacteria seem like they have a heyday under the environment of estrogen dominance. I don't know. Maybe it has something to do with the mast cells, because remember, the immune system ultimately is what protects you from bacteria and viruses and critters. So it could be that the bacteria are sensing the changes in the mast cells, and therefore they know that they could have a bit more of a jamboree. Not really sure, but it's worth kind of thinking about and being mindful of this if you're having dysbiosis or microbial imbalance. And then last but not least, estrogen and progesterone also seem to play a role in the inflammatory balance of the body. So I guess I'll just put up here. So remember, I've said this in a couple videos now, but I'll mention it again. Saying you have inflammation is helpful, but it's not super helpful. It's kind of like saying, I have soup. It's like, okay, well, that gives us some information for sure, but what kind of soup do you have? Do you have New England clam chowder? Side note, the superior type of clam chowder, in my opinion. Or do you have chicken noodle soup? Do you have tomato soup? Like, do you have a gazpacho? Like, what kind of soup do you have? And then we can learn how to deal with the soup. So saying you have inflammation or saying that estrogen dominance changes the inflammatory state of the body, I know is a big, broad, annoying thing to say. But in truth, I don't think we know specifically yet. And there are a million different types of soup. There are so many inflammatory mediators and signaling molecules and cytokines that can go toward making this soup that we call inflammation that I don't really know what else to give you. Other than it does seem like the nastier type of inflammation seems to be perturbed by this. So things like interleukin 6, interleukin 1 beta, NF-kappa B, those sorts of inflammation seem like they're especially upregulated in states of estrogen dominance, but who's to say? There's probably others that are as well, and we're just learning about it now. All right, guys, that's a wrap for today. I hope that this was helpful. Let me know if you want me to do a whole video on how I treat estrogen dominance in my patients. I figure it feels a little bit unrelated to the purpose of this channel, but if enough of you guys comment and say, yeah, we want to learn more about how to treat estrogen dominance, then I'll totally do a video on it. I just want to gauge if that's something that you guys would be interested in or if it would be kind of a waste of time. But in either case, I hope that this video and my other video about hormones have been helpful for you. If you want more information, you can check out the IBS Freedom podcast. We've done a couple of episodes recently about hormones. And you can check out more information in the link down below. I mentioned this in the hormone PTSD video, but I made a handout for you guys that outlines kind of the overall structure for how to treat hormone imbalance holistically. And I do have a special section of that handout totally dedicated to estrogen dominance, as well as a page dedicated to hypothyroidism. So if you want to flesh this out a little bit more, go check out the podcast, go check out that handout. Link is down below in the description, and I'll try to remember to put it in the first comment. And like I said, let me know if you want a treatment-focused video on estrogen dominance, or if I should just move on and start focusing on the gut microbiome or some other gut-specific topic for my next couple of videos. You decide. Choose your own, choose your own adventure, and I will see you in the next video, whatever the topic may be. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.